Hi everyone, we're Personality Traits and Temperament. We are doing this for our final oral project.
My name is Leilani, and this is our mission statement. Our goal is to enhance the understanding of human development, behavior, and health by examining the entrant relationships between personal characteristics, environmental influences, and systematic frameworks by combining insights from psychology, nursing, gerontology, social work, and therapy. We aim to understand issues as mental health, inequality, substance use, behavioral management, and equitable access to healthcare. Every field presents its own perspective. Psychology sheds light on personality and growth. Nursing brings valuable clinical knowledge. Gerontology emphasizes the significance of aging and finding purpose, and social work tackles societal obstacles. Collectively, these disciplines create an understanding of how people develop, adjust, and flourish within the larger context of social frameworks. Breaking barriers and building trust. In the United States, the relationships between healthcare professionals and minority patients is often strained by a deep-rooted history of discrimination, neglect, and systematic inequality. Being Black in America is to experience higher rates of chronic illnesses like asthma, diabetes, high blood pressure, and Alzheimer's, according to abcnews.gov. Black and Hispanics are at the highest percentage for refusing care and not being able to afford proper care or insurance. The color of care, exposing racial bias in medicine. Many historic policies and events were rooted in since disproved disbeliefs about biological differences by race and white supremacy. These inaccurate beliefs contributed to false ideas such as Black people feel less pain and to historic abuses and mistreatment of Black people in the medical system. In the 1800s, doctors experimented on Black enslaved women to develop new surgical techniques. Beyond the stethoscope, confronting millions of expected. Okay. Beyond the stethoscope, confronting bias in healthcare, Black women in the U.S. are nearly 3 times more likely to die during pregnancy or delivery. Mortality rate 69.9 per 100,000 live births in 2021, almost 3 times the rate of white women. There are many factors of healthcare bias behavior within minority patients, which includes vaccines, procedures, post-op, routine care, and more. In October 2020, 7 out of 10 African-American patients said they were mistreated by professionals in the healthcare system, according to CommonwealthFund.org. Mistrust in medicine, the change starts with me. As a soon-to-be Black healthcare professional in my career, I want to help and be the change for people who look like me. I want to inspire, help, and advocate for those who are in need. Everyone deserves the proper care and treatment, no matter the race, religion, gender, or sexual orientation. As more people come together to help make a change, we will see changes in our healthcare systems and be better providers for our patients. From disparity to care, a nurse visions for change. In conclusion, I want to help make a difference in the healthcare system for people like me. I want to feel comfortable with myself as a patient, trust and believe in my provider that I'm receiving proper care no matter how I look. Also, I want to reciprocate the same compassion as a provider to patients. I believe a change can happen. It won't be easy, nor will it happen overnight, but I want to change history for our future and for our next generations of healthcare providers. People rely on their providers and to help maintain their health and safety. And as a future LVN, I aim to give my patients the proper care. And that is my cited work.
The impact of child interaction during pediatric venipuncture. The way a parent responds to their child during a painful or stressful medication experience, like a blood draw, can have a lasting impact on how that child learns to handle emotional distress. These early moments can influence how child regulates their emotions, deal with future stress, and even respond to challenges in school or other social settings. Reassurance and distraction can have opposite effects on the child distress. Distraction has been found to be more effective in lowering a child's anxiety and perceived pain during the procedure. Parental behavior is shaped more by beliefs about how to comfort a child than by personality traits like empathy or anxiety. This means parents who believe that comforting their child verbally is the best method may continue using reassurance, even if it increases distress simply because they think it's the right thing to do. Understanding and adjusting these beliefs can improve both short-term and long-term emotional outcome for the child. And on the bottom right, I have my works cited.
All right, so mine is correlation between oral health and mental health. Oftentimes, you can tell how someone's mental state is by how they take care of themselves. Oral health often gets neglected during times of anxiety or depression, and sometimes both. Take an example of Nigeria, which I researched, a region of which is very poverty stricken and high levels of depression. Oral health is poor in this region due to the neglect and lack of resources. Lack of resources and poverty leads to depression, which leads to poor overall health, and it just turns into a big snowball. Generally speaking, in flourishing regions with the correct resources, it's likely that you will see people with not only good oral health but overall health, like their physical being and their mental being as well. On the bottom, I have some of my works cited. And how does this impact us? As a future medical professional in dentistry, it is really important to me that I help people with their oral health, but also their mental. As a medical professional, and just as well as being a good human being, I think it's our duty to be there to listen to our patients, other people, and help them in any way that is possible. I think this research provides an important insight for me because it amplifies the importance of oral health because of the effect that it has on mental health. This research has driven my passion further on wanting to help people with their oral health, but also their mental health as well. It is known to be said that, I mean, I used to work in a dental office before, and dental hygienist, which I'm wanting to be, can be viewed as like almost like a therapist in a way because you know a lot of their ins and outs. You know their full medical history. You know like their ins and outs of their life and what's kind of going up to date. And sometimes people just really want someone to talk to. And I think that as a medical professional, which a lot of us are, we can provide that. And I think that's really important.
My research was done on personality traits in adults with ADHD. The main goal of the research was to acknowledge that each individual with ADHD has different needs, and figuring out as a medical professional what the best course of action might be to treat them, whether that be through therapy or medication. The article offers perspective on ADHD by looking at how it affects adults, which can provide valuable insight into the long-term effects of the disorder and its influence on personality development. What is ADHD? It's a neurodevelopmental condition. It's characterized by persistent challenges with inattention, hyperactivity, and impulsivity, which can impact daily life, such as completing tasks, maintaining relationships, and achieving overall well-being. Some misconceptions that there are about ADHD is that people think it's only a childhood issue, failing to recognize the significance in adulthood. Gender is also another great misconception. Many people think that girls have lower levels of ADHD, but according to research done from 2011 to 2013, by the time individuals reach adulthood, research indicated that the prevalence of the rates are almost equal between both of the genders. Um, People often assume that all adults with ADHD exhibit the same behaviors or face identical challenges, overlooking the vast differences in personality and coping mechanisms. So, applying this to my career, by understanding the ADHD personality traits, I can better meet patients' needs, develop personalized care plans. Treatment should be individualized. It's always important to avoid a one-size-fits-all approach. As a future healthcare provider, I will appreciate neurodiversity and patient interactions, adapting my communication style to fit the patient's needs, and providing structure. It's crucial for me to understand the behavioral and emotional needs of patients, particularly in recognizing signs of ADHD and their effects on mood and stress. After all, nurses play a huge role in the process by creating consistent routines and facilitating effective communication. And this is my works cited.
Music therapy and its effect on postpartum blues. Music therapy is said to be very beneficial to women suffering from postpartum blues. It is very important for people to understand the physical, psychological, and physiological effects that postpartum blues has on women. Postpartum blues is a complex mood that occurs after pregnancy or giving birth. It includes irritability, sadness, anxiety, etc. It's also said that postpartum blues affects about 70 to 80% of women in the United States. From my research article, I found that the benefits for postpartum blues includes reducing anxiety. It also increases to the production of breast milk, and it also helps during delivery. In my career as a music therapist, I want to be able to encourage more women to take advantage of these types of services. It's very easy for people to become very discouraged because maybe they're worried about what other people may think. And I also just want to be able to have all of the tools to help women suffering from this problem get through this process successfully.
Hello, everyone. My name is Grant. So I'm focusing on addiction, as my career goal is social work, especially focusing on people who suffer through addiction. So addiction is when you have a need or urge to do something or use something that can interfere with your functioning in other areas of your life. It's possible to be addicted to anything, realistically, and living with an addiction can seriously damage your work performance and relationships if it's not addressed early. Addiction can be both environmental and genetic, as both factors play a role in every individual's life. Substances can have strong impacts on our feelings and emotions and can cause us to crave or desire these substances in order to chase momentary sensations of relief or elation. Addiction can be made as a way with coping with life stressors, and these can stem from anywhere: unemployment, abuse, poverty, trauma, mental health issues, etc. With any number of reasons equal to every number of substances available, an addiction is very easy to obtain for everyone. So, how can we really help with addiction? We have to kind of understand it. And so, when we undergo surgery, we are given medicine known to be addictive. Diamorphine and fentanyl are just a couple of these products, although no one becomes addicted to these even after receiving the treatments. And the reason is understanding addiction as a reason rather than just a want. So during the Vietnam War, 20% of American troops used heroin to cope with the horrors of the war. However, only 95% of the troops ended up quitting the moment they returned home. So only 5% of that 20% became addicted. And so it's about understanding that when they came home, they had their support systems, they had their families, they had their friends, they were able to return to their lives. But for many of those that didn't have those support systems, the addiction became the replacement for that support system. And so it's understanding the cages that we are pushed into because of the enabling of our addictions, not just the substance. The internet, porn, gambling, gaming, these can even be smaller examples of what addictions could look like. And we often imprison addicts, shut them out, banish them, and but the only way to really defeat an addiction is to make a connection and to help support people and help them heal. And then below is my works cited.
Hi everyone, my name is Akira and my career path is psychology, but more specifically criminal psychology. So we'll be starting off with the link between temperament and behavioral patterns, which happen to be lifelong. What even is effort for control and negative emotionality? Effort for control is one's ability to regulate their attention, control impulses, and delay gratification. And negative emotionality is a tendency toward emotional instability, irritability, and anger in response to stress. These temperamental traits, which means they appear during earlier stages of life and are at least partially genetically influenced. Why do these matter? Well, they matter because children who don't have the ability to regulate attention, who are low in FF4 control, often find themselves struggling to follow these rules, or pay attention in class, or even figure out how to manage conflict. Children who have high negative emotionality are more prone to emotional outbursts, general aggression, issues with rejection from their peers. Now, when you combine all these traits, we are faced with major predictors of externalizing behaviors. We expect behaviors such as defiance, substance abuse, and law breaking. Vaughn, from a 2013 article, said that temperaments traits like low effort for control and high negative emotionality are reliable predictors of later criminal behavior. Childhood traits that follow into adulthood, from the classroom to the courtroom. Children who can't self-regulate are more likely to get suspended or expelled and end up being diagnosed with behavioral disorders like ODD or ADHD. They find themselves engaging in bullying or disruptive behaviors. Over time, these feelings and challenges lead them towards a path or social isolation, failure academically, or finding themselves with increased contact within the juvenile system. Is it just the environment or temperament or both? Even in the most supportive, loving household, children can exhibit these traits. The risk increases, though, when children have a low amount of supervision and live within poverty or are subjected to communities that have violence. This matters because we need to understand temperament to find aid, whether it be help from teachers, counselors, or psychologists to find tools to intervene early. Let's not forget behavior is not always willful disobedience, but rather it could be an issue with regulation and not a moral one. What this means for my work in criminal psychology. Connecting research to practice. Hoping to become a criminal psychologist, I will use these findings to try and assess individuals for temperament risk factors. I will design interventions that target these issues with emotional regulation, impulse control found in children. And most importantly, advocating for developmental approaches within the legal system when it comes to juveniles and not just punishing them outright. We need to step away from punishment and towards prevention. I feel like we must try to recognize these earlier signs of effort for control and emotionality issues. And by doing this, we can redirect the path of the youth away from involvement with the justice system and push for rehabilitation programs that will address root causes, not just the symptoms. The broader implications are that support for trauma-informed care and restorative justice models will go a very long way with stepping in and trying to reform learned behaviors for systematic change within health, behavior, and justice.
So our conclusion. Um, so we work together a lot about the personality and temperaments of everyone through all facets of the career fields that we're trying to get into. And so wherever we go, no matter what kind of life we lead, we are always part of a world around us, and we are susceptible to its vices. The world can be both a beautiful and a cruel place, and sometimes navigating it can be a frustrating and different, or rather difficult experience. Humans are very fallible, and we can be made to follow any number of paths. And it is with kindness and understanding that we are all victims of these circumstances we call life, that we can try to understand each other a bit more. We live in a shared world, and it's important to understand what kind of world we would like to live in and try to make that our best example.